A very good afternoon and welcome to our session on topic factors affecting IVF cycle. We are glad to have our expert doctor Meenal Chidgupkar talks about this topic briefly. The doctor will help us understand this and a lot more in our sessions. If you have any questions, any doubt, put in the comment section below. And if you want to have any guidance from the doctor apart from the topic, you can just put there, and the doctor is here to help you. Doctor, you have the stage.
Namaste. I'm Dr. Meenal Chidgupkar, Senior IVF Consultant from Apollo Fertility, Solapur. आज मैं आपसे डिस्कस करने जा रही हूँ कि आईवीएफ के सक्सेस होने के चांसेस कैसे रहते हैं। जब आईवीएफ के लिए कपल्स हमारे पास आते हैं इनफर्टिलिटी क्लिनिक में, उनके पास बहुत होप्स रहता है कि डॉक्टर हमने बहुत सारा ट्राई किया है, नाउ वी हैव कम टू यू, नाउ वी वांट एवरीथिंग 100%. But my friends, I'll tell you, IVF is not an 100% science. It is variable. It is an orchestrated events that are happening one by one, and that requires accuracy, timing, and all these procedures have to be done in a very proper and a methodical ways. So IVF में exactly होता क्या है? आईवीएफ में जब कपल हमारे पास आता है, हम उनके बेसिक इन्वेस्टिगेशंस करते हैं. उनके इन्वेस्टिगेशंस में कुछ हमको प्रॉब्लम्स लगे तो देन वी एडवाइज सम अदर इम्पॉर्टेंट टेस्ट टू देम. देन वी मेक ऑल देयर फैक्टर्स, हार्मोनल फैक्टर्स, इन अ गुड रेंज and give them medications to make them in a healthy range. Then if the BMI is high, like body mass index, very high weight, we advise them to reduce the weight. We advise for their healthy lifestyle to avoid stress, and then we start our IVF treatment. We usually don't do cycles in batches because we believe that when they get their own menstrual cycle, and we start our IVF treatment from that point, then the success rates are little more than when we do the batches. So when the couples come with great hope and they ask us about what are the, see doctor, you are saying it is not 100%, then tell us what are the percentage in our case. So IVF success, when we are like generally telling you in as a perspective, that IVF success depends on many factors. First and foremost important factor is age, and in that, age of male and age of female is very important. When the age increases, then the success of IVF also decreases. When the women's age goes more than 40 years, the IVF का success rate almost 10 to 15% हो जाता है. When this age is less than 30 years, the IVF success can reach up to 50 to 60%. So in the middle, like 30 to 40 years, the according to the age, that IVF success will vary. The same thing happens with the male factor, as though they have the sperm count okay, and everything is okay, but with the age there's a concept called DNA fragmentation index, and that also increases in the sperms. So there can be chances of IVF failure or implantation failure or recurrent pregnancy failure in those couples. The second important thing in cases when we look for the IVF success is the type of fertility issue. That the why that person has that fertility issues, that we have to find out. Then we have to find out how many years of infertility they are facing. When they have very long period of infertility, then we really have to think about, is there any immunological cause or any other factor that is causing this infertility. And if the anatomical factors like fibroids, then any other genetic causes, those are the causes of infertility, then accordingly we have to see how this IVF cycle has to be done in that particular way. Then we have to ask the patient, if the patient has had any previous pregnancy or abortion, or it is like only primary infertility. Even if there are recurrent implantation failures or the multiple abortions, then we have to actually see many hormonal factors, immunological factors, decide accordingly ki, what we have to do in those cases, treat them properly, and then only further treatment has to be done. Then when we start our cycle, so almost from the day 2 or day 3, we start their stimulation drugs, and the cycle is started. We frequently check them on ultrasound to see whether the cycles are proper or not, and we have to decide whether we have to start the cycle or we have to continue the cycle, or uh, stop the cycle, and accordingly further decision has to be taken. So once we do, after 10 or 12 days, once we do the ovum pickup for those patients, then we understand that if uh, after the ovum pickup we are getting enough good quality eggs, so the embryos which are going to form in the laboratory have how they will be formed will depend on this quality of eggs and also the quality of sperm. So the laboratory parameters, how the stimulation drugs have acted on their follicles, how we have received this follicular fluid, and how many mature eggs we have got. All these factors are very important for laboratory. Once we send those fluid to laboratory, and accordingly we have to see the embryos are formed or not. So once the embryos are formed, from day 3 or day 5, we have to see how the embryos are, the grading of the embryos. We usually see through the Istanbul grading that day 3 embryos, are they grade A, B, C, or if day 5 embryos, the blastocyst staging has to be done, and then we get to know that these embryos are good, then there are good chances. When A grade embryos are there, vacuolations are less, fragmentations are less, then the success of IVF is more than other embryos, such as C grade embryos and C and D grade embryos, where we don't put them. The B grade embryos has the intermediate chance of IVF success. So grading of these embryos also is very important in the IVF success programs. Then we have to see the sperm quality also. If the sperm quality is not proper, or if there is a lot of uh, DNA fragmentation index wise it is more, then also there is a chance that fertilization failure can happen. In certain cases where there is a problem with the development of follicles, or such as uh, premature ovarian failure, then we have to think about third party reproduction. And in cases of azoospermia, and where TSA is not going to work, then also we have to think about the third party reproduction in terms of donor sperm, or the donor oocyte donor. So if the oocyte donor is used, then when they are young, the sperm, the ovum quality, and also young sperm donors, the quality will be good and the success will be more. Then also it depends upon what IVF protocols you have been using. So when we do the controlled ovarian stimulation, हमको देखना है कि ये स्टिम्युलेशन किस तरह से हो रहा है. In polycystic ovarian syndrome cases, there are certain gonadotropin stimulation protocols. Also, low ovarian reserve, there will be different stimulation protocols. And in normoresponders, it will be different. And according to these stimulation protocols, also the IVF success rate is dependent. So, experienced IVF specialist you need to go to them and get your treatment done. Then another important factor is embryo transfer. Embryo transfer is a very simple process, but that has greatest implication in this IVF success, because कि ये एम्ब्रियो ट्रांसफर, हमारे जो एम्ब्रियो बने हैं पेशेंट्स के, तो उनका ट्रांसफर हम फ्रेश एम्ब्रियो ट्रांसफर करते हैं या फ्रोजन एम्ब्रियो ट्रांसफर करते हैं, उससे भी बहुत फर्क पड़ता है. पॉलीसिस्टिक ओवेरियन सिंड्रोम केसेस में यूजुअली हम फ्रोजन एम्ब्रियो ट्रांसफर के लिए जाते हैं, या वेरी लो ओवेरियन रिजर्व है और अपने पास एक या दो ही एम्ब्रियोज मिले हैं, and then we do the second cycle and we get few more embryos and then we transfer those embryos, the success will be more. So overall सब वर्ल्ड में अभी according to patient fresh and frozen embryo transfer डिस्कस किए गए हैं और उसका सक्सेस रेट देखा गया है. According to the clinical expertise, whether to do fresh embryo transfer or frozen embryo transfer will be decided in your case, and the transfer will be done. In the transfer, if it is done very smoothly and with in the expert hands, then and the embryos are good, then the success is more, rather in cases of डिफिकल्ट ट्रांसफर. जब ट्रांसफर डिफिकल्ट है, अंदर एम्ब्रियो डालने में तकलीफ हो रही है, रिटेन्ड हो रहा है कुछ, तो थोड़ा उसमें डिफिकल्टी आ सकती है, आईवीएफ सक्सेस में थोड़ा हर्डल आ सकता है. देन बहुत एक इम्पॉर्टेंट चीज़ है, वो है यूटेराइन रिसेप्टिविटी. ये जो यूट्रस रहता है, इसके अंदर हम एम्ब्रियोज छोड़ते हैं, तो ये जो उसका लाइनिंग रहता है, दैट हैज़ टू बी रिसेप्टिव. तो ये लाइनिंग रिसेप्टिव है, ये हमको कैसे पता चलता है? व्हेन वी सी योर pelvic ultrasound, that time we are watching ये endometrium lining कितना बन रहा है, and simultaneously we see उसको blood supply कैसे मिल रहा है. तो उसके हिसाब से we decide the time from where we have to start our progesterone injections or gel or vaginal progesterone, and then we decide when the transfer has to be done. सो ट्रांसफर थर्ड डे के एम्ब्रियो की भी हो सकती है या फिफ्थ डे के एम्ब्रियो की हो सकती है. तो अकॉर्डिंगली टाइमिंग्स डॉक्टर डिसाइड करते हैं और एम्ब्रियो ट्रांसफर करते हैं. सबसे इम्पॉर्टेंट चीज़ है, जो भी डॉक्टर आपको ड्रग्स बोले, वो ड्रग्स उसके प्रॉपर टाइम में लेना ज़रूरी है. इफ़ यू मिस इवन अ सिंगल ड्रग, दिस बिग साइकिल will fail. So it is very, very important to take those drugs meticulously, and even in the center, if it is like sister is giving those injections, gonadotropins, even antagonists, that has to be given at a proper time and in a proper aseptic conditions. Then we usually, as I told you before, कि जब पेशेंट्स हमारे पास आते हैं तो हम उनको पहले से ही बता के रखते हैं कि नाउ वी आर स्टार्टिंग योर आईवीएफ साइकिल. तो आपके पास जो 1-2 मंथ है, जिसके बाद आप चालू करने वाले हैं ये साइकिल, दैट उनके लाइफस्टाइल में थोड़े से चेंजेस उनको करने पड़ेंगे. तो उनको थोड़ा एक हाफ एन आवर एक्सरसाइज करना पड़ेगा, हेल्दी डाइट लेना पड़ेगा. इफ़ दे आर लाइक एडिक्टेड टू स्मोकिंग और अल्कोहल, दे हैव टू कीप those things away, at least for this IVF cycle and in the future pregnancy also. So all these factors are important in the IVF success. तो यूजुअली कैसा होता है कि जब प्रेगनेंसी पॉजिटिव आती है IVF के बाद, सारे खुश रहते हैं, कुछ बताने का भी ज़रूरत नहीं रहता. बट व्हेन द प्रेगनेंसी इज नेगेटिव, देन एवरीबडी आस्क्स क्वेश्चन from the relatives, from husband, wife, and that time telling them all these things, they are not in the receptive mood also. So what I feel personally is, when the patient comes to you in the initial few counseling, you have to explain them all these factors, how the success of this IVF is changing in different factors of their like the women factor, male factors, कैसे उस पर डिपेंडेंट रहता है IVF सक्सेस, जितना वो हॉस्पिटल, डॉक्टर, IVF लैब, इस पे भी डिपेंडेंट रहता है. तो सारी चीज़ों को एक साथ मिला के मतलब सारी चीज़ें राइट हो तो ये सक्सेस होने का चांस ज़्यादा रहता है. So I usually tell them we have in Apollo Fertility a very good lab, IVF lab, and we do all the procedures very meticulously, and we have got very good success rates in all the centers of Apollo Fertility. So I really want to tell these couples that they should come up with their questions before starting their IVF cycles, discuss with doctors कि कौन सी चीज़ें हैं कि जिसके ऊपर ये IVF का सक्सेस कम हो सकता है या ज़्यादा हो सकता है. Accordingly, they have to make their lifestyle changes such way that that will help in their IVF cycle. And one very important thing is doctor and patient has to be very positive throughout the cycle. तो पहले सारी चीज़ें उनकी करेक्ट करके जितना जितनी सारी चीज़ें राइट करने का ट्राई कर सकते हो उतनी करके प्रोसीजर्स परफेक्टली करके ट्रांसफर परफेक्टली करने के बाद then only and keeping your morals always high, always believing in certain because certain times even we are surprised that patients getting pregnant even with the one embryo, one good quality embryo. So the patients throughout the cycle have to be very positive. And second important thing, always remember the IVF is not 100% science. So if in certain cases, unexplained cases, the cycle becomes negative, don't get disheartened so much that you just stop doing anything or not going for the second cycle, because we have seen that even if the first cycle patients getting negative, in the second cycle or third cycle they are becoming positive. जैसे कि एक एग्जाम में हम गए और एग्जाम दिया तो ऐसा नहीं है ना वो एग्जाम फेल हो गए इसका मतलब वी वी आर नॉट अ सक्सेसफुल पर्सन. नो, वी हैव टू ट्राई टिल reasonably everything is okay. We have to try and work towards our success, our positive results. And the same thing I want to convey to our listeners also, that come with more and more questions, discuss with doctor before starting any IVF treatment, get your doubts cleared, and then go towards your IVF process very positively. Thank you.